Calcium is one of the most important minerals for your body, but you do not want to take calcium supplements unless your doctor tells you to do so because it can cause more harm than good. So what are the symptoms that you should be aware of after That's what we're going to talk about in today's video. I'm a family physician. If you find this video helpful, please subscribe and like this video. These actions help my channel tremendously. Let's talk about low calcium and the symptoms that you should not ignore. Are you constantly feeling tired and lacking energy? Fatigue is another symptom of low calcium in your blood. Did you know that low calcium levels can affect your mood? A study published in the Journal of Endocrinology and Metabolism found that rats with low calcium levels exhibited depressive-like symptoms. A study published in the journal Biological Psychology found that rats with low calcium levels had difficulty falling asleep and staying asleep. It's thought that calcium helps regulate the production of melatonin, a hormone that promotes sleep. Do you often feel disoriented or have trouble concentrating? Confusion can be a sign of low calcium in your blood. They can perform a simple blood test to measure the amount of calcium in your blood and determine if you have hypocalcemia. So it's important to work with your healthcare provider to identify and address any potential underlying issues. If you've enjoyed this video, please hit the like button and subscribe. Also, please share this video with anyone you think it might help. And don't forget to stay tuned for our upcoming videos. The treatment for hypocalcemia will depend on the underlying cause and severity of your symptoms. In some cases, you may be able to increase your calcium intake through diet alone. However, in more severe cases, your healthcare provider may recommend calcium supplements or other treatments to help raise your calcium levels back to the normal range. When calcium levels are low, it can affect the brain, leading to difficulties with concentration and memory. This is because calcium plays a role in the transmission of nerve impulses, and it's essential for normal brain function. Additionally, low calcium levels can lead to the formation of new abnormal blood vessels in the brain, which can disrupt blood flow and oxygen supply, further contributing to confusion and cognitive impairment. When calcium levels are low, melatonin production may be affected, leading to insomnia. While more research is needed to fully understand the connection between hypocalcemia and depression, it's possible that calcium plays a role in regulating neurotransmitters, which are chemicals in the brain that affect mood and emotions. If so, low calcium levels may be a contributing factor. In fact, hypocalcemia is a well-known cause of seizures in children. Low calcium levels can lead to abnormal electrical activity in the brain, increasing the likelihood of seizure activity. The exact mechanism by which hypocalcemia causes seizures is complex and not fully understood, but it's thought to involve the role of calcium in regulating nerve excitability and neurotransmitter release. Calcium is involved in the process of converting food into energy. Do you often feel nervous and uneasy? This could be a sign of low calcium in your blood. Anxiety is a normal response to stress, but it can become problematic when it's excessive or persistent. Some studies suggest that low calcium levels may contribute to anxiety by affecting the balance of neurotransmitters in the brain. For example, calcium is involved in the release of serotonin, a neurotransmitter that plays a role in regulating mood and emotions. When calcium levels are low, serotonin levels may also decrease, leading to feelings of anxiety and depression. When there isn't enough calcium in the body, this process can be disrupted, leading to feelings of tiredness and exhaustion. For instance, people with chronic kidney disease often experience fatigue due to the fact that their kidneys are unable to properly regulate calcium levels in the blood. As a result, they may suffer from hypocalcemia, contributing to their overall fatigue. Now, many people think that getting enough protein and vitamin D is the only thing you need to do to keep your bones strong after 50. Do you often experience pain and tenderness in your bones? This could be a sign of low calcium in your blood. Calcium is a key component of bones, and it's essential for maintaining their strength and density. When your body doesn't have enough calcium, it can lead to bone pain and tenderness. For example, osteoporosis is a condition that occurs when the bones become weak and brittle due to a loss of calcium and other minerals. This can make the bones more susceptible to fractures, even from minor injuries. People with osteoporosis often experience bone pain, particularly in the spine and hips. This could be a sign of hypocalcemia. When calcium levels are low, it can affect the nervous system, leading to abnormal sensations such as numbness and tingling. Additionally, low calcium levels can cause hyperexcitability of the nerves, leading to a condition called paresthesia, which is characterized by a tingling, burning, or needle-like sensation. Paresthesia is commonly associated with diabetes, but it can also occur due to hypocalcemia. But did you know that it is also essential to consume enough calcium? In fact, having too little calcium in your blood is much more common than having too much calcium in your blood. And having low calcium in your blood causes more problems than having high calcium in your blood. You may be surprised to learn that 20% of women over the age of 50 have low calcium levels, whereas only 3% of men over the age of 50 have low calcium levels. In this video, we will discuss 9 of the most common symptoms of low calcium that you should not ignore after 50. The first symptom of low calcium that you should not ignore is muscle spasm or cramping. Do you often experience sudden, involuntary muscle contractions or spasms? This could be a sign of low calcium in your blood. Calcium plays a crucial role in regulating muscle function. And when your body doesn't have enough calcium, it can cause your muscles to become overactive, leading to cramps and twitching. For example, if you're an athlete or frequently engaged in strenuous physical activity, you may be at risk of developing exercise-induced hypocalcemia, which can result in muscle cramps. Similarly, people who consume excessive amounts of caffeine or alcohol can also experience muscle cramps due to the diuretic effects of these substances, which can deplete calcium levels. Symptom No. 2 is numbness and tingling. Do you often feel a strange, prickly sensation in your fingers, lips, or around your mouth? No. 3 is fatigue. Number 4 is bone pain. The 5th symptom is depression. No. 6 is anxiety. The 7th symptom is insomnia, having trouble sleeping. Low calcium may be to blame. The 8th symptom is seizures. Are you prone to seizures? The 9th symptom of low calcium that you should not ignore is confusion. If you're concerned that you may have low calcium levels, it's important to consult with your healthcare provider. It is also worth noting that having low calcium levels can be a sign of an underlying medical condition, such as kidney disease or vitamin D deficiency. Thank you so much for watching today's video about the 9 symptoms of low calcium that you should not ignore after 50.